Well, what's the common denominator of type 2 diabetes, obesity, metabolic syndrome, narcolepsy, reactive hypoglycemia, anxiety attacks, panic attacks? Let's see here. Congestive heart failure, degenerative, just a minute here, I can't remember right, ADD, ADHD, autism, depression, manic depression, bipolar disease, schizophrenia, bipolar disease. What's going on here? Okay, what's the common denominator? Well, they're all mineral and or vitamin deficiency diseases, and they're all impacted by the consumption of sugar. Okay, they all get worse with the consumption of sugar, but they're basically mineral, in some cases, mineral plus vitamin deficiencies. All right? And so I want you to get a hold of the CDs called Deadly Recipe, Serial Killer, God's Recipe, and Hell's Kitchen. Then the books, Hell's Kitchen and Epigenetics, The Death of the Genetic Theory of Disease Transmission. Let's just look at a couple of them. We've known, for instance, that type 2 diabetes, long thought to be a genetically transmitted disease, really a single deficiency of a mineral. We've known it for 70 years. Obesity, long thought, maybe 75 to 100 years, that it's due to lack of exercise and eating too much, is simply a mineral deficiency. And again, it is made worse, that deficiency is made worse by consuming things like carbohydrates and sugar in response to the symptoms of mineral deficiencies, which is cravings and binge eating and the munchies. Metabolic syndrome is sort of pre-diabetes, belly fat, obesity, and high blood pressure. Okay? All due to mineral deficiencies. And so let me tell you, they run together, and many people would say obesity causes type 2 diabetes and metabolic syndrome. That's not true. They all run together, not because one causes the other, but because they're all mineral deficiencies. And when you're deficient in one, the odds are you're deficient with another one. When you have things like narcolepsy, which you sort of fall asleep in the middle of a conversation, another name for it is reactive hypoglycemia or hyperinsulinemia. That's the word I was trying to read, hyperinsulinemia, high blood insulin. You take in a high sugar meal, what happens is you release a lot of insulin, it smacks that blood sugar down too low, and you fall asleep in the middle of a conversation while you're driving, cross the center line, and kill yourself or somebody else. And then, of course, anxiety attacks and panic attacks. This is when your blood sugar is falling. It's kind of a variation on reactive hypoglycemia, where you're getting a manifestation in a behavior. And panic attacks, again, and anxiety attacks are very, very similar. It's just one person's panic attack is another person's anxiety attack, depending on degree. ADD, ADHD, you have to appreciate ADD, ADHD, and autism. In 1980, it was 1 out of 250,000 kids had it. 1990, it was 1 out of 2,500. In 2000, it was 1 out of 850. And in 2005, it was 1 out of 185. In 2010, it was 1 out of 85, and now it's 1 out of 44. That's because all these kids are eating all this cereal and soft drinks, and they're not really getting the 90 essential nutrients, 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And the reason why we're feeding these kids this stuff is not out of good judgment, just time constraints. You know, the parents have to go to work. They got to get the kid to day's care. So they throw at them these Fruity Pebbles and apple juice, Welch's grape juice, and Sunny Delight, and Eggos, and oatmeal, and all kind of stuff. And the body can't take that much carbohydrate and sugar. As a result, we have all these diseases. They're getting worse and worse and worse and worse because our society requires shorter sleeping time, less eating time, and more travel time. And as a result, people are just trying to shortcut everything they can. When I grew up, we had 4 generations living in our same household. And when mom and dad and grandma and grandpa went out to work in the fields or at their part-time jobs or whatever it is they did, there were 2 generations, still great-grandparents and great-grandparents, taking care of you in the house. And we ate our cultural diets, which are Ukrainian. All 4 of my grandparents were beet farmers, you know, the little red root crops, beets, and beef farmers. So we had hamburgers and steaks and beef ribs and beets for breakfast, lunch, and dinner. Every once in a while, they'd throw in baked sweet potatoes and tomatoes and things like that. But it was a pretty consistent diet, okay? And so we did supplement by throwing wood ashes out in the garden, and we ate the peas and beans and squash and whatever was growing out in the garden, the sweet potatoes, onions, sucking up all those minerals from the wood ashes. So we got some minerals in that fashion. I guess we lucked out. We did have a few mineral deficiencies, but none of these behavioral problems that are attributed to no diabetes, no obesity, certainly no obesity. And then the metabolic syndrome, nobody had metabolic syndrome. And so I urge you again to get a hold of the CDs, Deadly Recipe, Serial Killers, God's Recipe, Hell's Kitchen. Get the books, Hell's Kitchen, and Epigenetics, The Death of the Genetic Theory of Disease Transmission. Actually, you can also throw in Rare Earths, Forbidden Cures. And those books are going to teach you everything you need to know about metabolism of nutrients, particularly minerals, and what happens when you're deficient in these things. Congestive heart failure is a deficiency of a single vitamin, and when you take in a load of sugar, it makes it 10 times worse, maybe 100 times, maybe 1,000 times worse, depending on how deficient you are in that one vitamin that causes congestive heart failure. There is a dementia called Korsakoff syndrome, another related one, Wernicke-Korsakoff syndrome, which is a deficiency of that vitamin, plus MS mixed in with it. And you eat extra carbohydrates, like a second piece of toast for breakfast or 2 waffles for breakfast, guess what? You're in deep trouble. So guess what? Get a hold of these books and CDs and learn how to take care of yourself, and you won't need to go to a doctor and put yourself at risk. Well, stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk about sugar consumption, as I have a Associated Press story here headlined, UN says to cut the world eating excess sugar, suggests cutting it by 5 to 10% from the diet. These new guidelines from the World Health Organization say that the world is eating too much sugar. They should slash their sugar intake to just about 5 to 10% of overall calories. And these guidelines are after a year of consultation. They had to look at this for a year, Doc, before they could figure out they needed to reduce sugar. And they go on to say that these added sugars to processed foods and those in honey, syrups, and fruit juices, the advice did not apply to naturally occurring sugars in fruits, vegetables, and milk. According to Francesco Branca, the director of the World Health Organization's Nutrition Department, says we have solid evidence that keeping intake of added sugars to less than 10% of total energy to intake reduces the risk of weight gain, obesity, and tooth decay. No mention of diabetes there. And in the United States, adults get about 11 to 15% of their calories from sugar. And children, it's about 16% in Europe. The sugar ranges from 7% in Hungary and Norway to 17% in Britain, and in nearby Portugal, 25%. Experts said that 10% target was a little more realistic for Western countries than the lower target. They say 5% daily calories figured was aimed mostly at developing countries where dental hygiene isn't good enough to prevent cavities. U.S. health authorities released their own guidelines recommending sugar be limited to 10% of daily calories. According to Tom Sanders, he is a professor of nutrition and dietetics at the King's College in London, and he says to get down to 5%, you wouldn't even be allowed to have orange juice. And they go on to say, shouldn't be difficult for most Britons. They get their sugar intake about to 10% of their diet if they limit things like sugary drinks, cereals, beer, cookies, and candy. World Health Organization said that most people don't realize how much sugar they're eating because it's often hidden in processed foods not considered sweet. 1 tablespoon of ketchup has about 4 grams. That's 1 teaspoon of sugar. Single can of soda has up to 40 grams, which is 10 teaspoons of sugar. Whoa, there's a reason why I don't drink that stuff.
Oh, you done?
Yeah.
Okay, well, that's a great report. And, of course, it goes along with what I talked about. Sugar makes nutritional deficiencies worse because when you consume sugar, you require more nutrients to get through the metabolic process. And as a result, if you have a deficiency, the bigger sugar load you take in, the bigger the deficiency. And so sugar drives a lot of diseases. Again, dementias, congestive heart failure, emotional problems. And so really, what you want to do is keep your sugar down to a minimum of, I'd say, 5% or less of your calories, and consume more protein, high-quality protein. I like egg protein because it's 100% biological value. Red meat is 72%. Beans and those sorts of things, beans are, I think it's 60%. And grain proteins, like wheat proteins, if you can consume them, you're not gluten intolerant, you're looking at getting 42% of the protein value, whereas egg protein is 100%. That's the benchmark by which all proteins are looked at. And when you look at the top 20 longevity cultures, they live on meat, eggs, and minerals. They live on meat, eggs, and minerals, and carbohydrates are a very, very low part of their diet. Their total calorie intake is somewhere around 600 to 900 calories a day, and their sugar intake is less than 0.5%. And they have 40 times 100 as we do. So it's time to really avoid sugar and get used to the taste of food without all that sugar. Thank you, Doug. Super, super input. And we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Pennsylvania. And Cathy, you're on with Dr. Wallach.
Hello, Cathy,
Hi,
you're on the air.
Hi, Dr. Wallach.
Hi.
A friend has been taking Prilosec for the past 9 to 10 years due to being diagnosed with eosinophillic esophagitis, a food allergy. She said that inflames the esophagus. She'd like to get off her Prilosec, but her doctor, who's a chiropractor, told her that she'll probably never be able to do that because her stomach isn't making the acid needed anymore, and that she's at risk for more osteoporosis. Another question I had is...
Oh, no, we got to stick with one at a time here.
Oh, I mean, that's still the same question, but I just wonder, I love essential oils. I'm really into essential oils. I was just wondering, too, might you be able to even recommend an essential oil for massaging in addition to your recommendation?
Okay, that's a different question to me. Okay.
Oh, sorry.
Okay, at any rate, how much does this lady weigh who's doing the Prilosec?
I'd say about 150.
150 pounds, okay. Well, when a person has reflux and esophagitis... this means they do not have enough stomach acid. There is no such thing as acid reflux. It's all a scam, okay? Really, it should be called lack of acid reflux. What happens is when you don't have enough stomach acid, your pH in your stomach's up around 4 or 5. You're moving towards a neutral 7, where it really should be down at 1.2, 1.5, well below 2. It's not sterile anymore when you get up to 4 and 5 because yeast and bacteria will grow in the 4 or 5 pH range, just like in vinegar. And after a while, yeast and bacteria grow there, and it's a perfect place. It's dark, it's wet, it's warm, and every time you eat carbohydrates or sugar, those yeast and bacteria produce gas, and you get reflux and belching and burping and bloating and sort of spitting up a little bit of the stomach contents, so it causes erosion of the stomach and also the esophagus. And so basically, I would definitely get this person on a gluten-free diet, okay? Absolutely no carbonated drinks, no alkaline water during meals, no fried foods, no processed meats with nitrates and nitrites, no oils. And Shar, what would you give this lady who's the doctors say doesn't make enough stomach acid, going to get osteoporosis, 150 pounds, what would you do for her?
I would give her enzymes because they help build up her stomach acid again.
Okay, absolutely. And because they're worried about osteoporosis, what would you do for that?
Oh, she needs a healthy bone and joint pack.
Yep, exactly. You give A+ for you, girl. Okay, now 150 pounds. We're talking about 2 healthy bone and joint packs per month. That'll be 1 ounce of the OsteoFX Plus at breakfast and dinner. 2 scoops of the Beyond Tangerine 2.0 NutriCrystal at breakfast and dinner. 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day. 5 at breakfast, 5 at lunch, 5 at dinner. All that will be taken care of by 2 of the healthy bone and joint packs per month. And as Shar said, the ultimate enzymes for stomach acid, I'd give her 9 of those a day. Okay, 2 or 3 before each meal with a couple ounces of water. And for the esophagitis, I'd give her the CM Plus capsules, anti-inflammatory all over the place. And swallow her 3 of those 3 times a day. And she'll be able to get off the Prilosec and have a normal life. Thank you, Cathy. We'll be back after these messages.
Well, let's head to Delaware. And Gloria, you're on with Dr. Wallach.
Hello, Gloria. You're on the air.
Hi, Dr. Wallach.
Hi. What's up?
Back in December, I was diagnosed with a heart murmur, and I also was calling in reference to I have symptoms with menopause, hot flashes, cold flashes, and I wanted to talk to you about my granddaughter too, but I guess you can do me first.
Okay. How much do you weigh?
I weigh 179 pounds. I have started on a Healthy Start pack like a week ago, and I lost like 5 pounds already.
All right. Yeah, you take the nutrients, because remember, being overweight is what? It's a nutritional deficiency. Very good. Lost 5 pounds already. How tall are you?
I am 5 feet tall.
Yeah, if you're 5 foot tall, guess what? You're 79 pounds overweight yet, so we got to work on that. Yeah. Okay. Now, here we go. Shar? Gloria's about your height, Shar. She's 5 foot tall. And I know you weigh about 100 pounds soaking wet. And so what would you do for Gloria here, who has a heart murmur? And wait a minute. Gloria, did they put you on any medication for the heart murmur?
I have been taking like a high blood pressure medicine for about 10 years. It's like a fluid pill, hydrochlorothiazide, which is for high blood pressure or fluid gain.
Okay, any other disease you have we don't know about? Any skin problems, asthma, constipation, diarrhea?
No, but I do have irritable bowel syndrome.
Okay.
And diverticulitis.
Okay. And okay, Shar, what's going on here?
She's got a gluten intolerance.
Yep.
She needs to get on a gluten-free diet immediately.
Yep. Okay. And what would you do for her for the heart murmur and the menopausal symptoms?
Well, I give her two actually now.
Yep.
2 healthy brain and heart packs, and she could take the women's FX for the female problems.
Okay. And what would you give her for the blood pressure?
I give her Ultimate Daily.
Perfect. Okay. So exactly as Shar says, Gloria, you want 2 of the healthy brain and heart packs per month. It'd be a full dose of everything twice a day. For the menopausal symptoms and hot flashes and night sweats, I'd go ahead and take an ounce twice a day of the Woman's FX. It'd be 2 quarts a month. It's a blend of herbs. It's a 150-year-old formula that works every time. We do have another female product which makes your ovaries work a little bit harder, make more estrogen and progesterone. It's called Xerafem. It's a new one, Xerafem, Xerafem. I want you to take 3 of those twice a day. That's 2 bottles a month. And then for the high blood pressure, as Shar said, I want you to take the Ultimate Daily tablets. Take 3 of those twice a day. That's 1 bottle a month. It's a big bottle. And none of the bad stuff. None of the bad stuff. And by getting off of gluten, wheat, barley, rye, and oats, your diverticulitis and your IBS will go away. Okay? These things are due directly to gluten intolerance. No fried foods, no processed meats, no oils, including olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oils. Give us a call every 2 weeks. And if you hang on, if you have another question, you said, hang on, Gloria, we'll give you another question here after these messages. Okay, Doug, we're going right back to Delaware with Gloria. Okay, you said you had another question for a daughter?
Yes, my granddaughter.
Okay.
She's ADHD, and she has asthma. She's been diagnosed as being oppositional and defiant, and she also has a heart murmur.
Okay, did they say why she has a heart murmur?
No, but my granddaughter was very premature when she was born. She was 1 pound and 13 ounces, and she's also a twin.
Okay, how old is she now?
She's 8 years old.
Okay, and what does she weigh?
60 pounds.
Okay, now is she an identical twin or a fraternal twin?
She's a fraternal twin.
Okay, now, Charmaine.
Yes, Doc.
Okay, now here's a kid with asthma, weighs 60 pounds. What's her problem?
She's got a gluten intolerance for sure.
Came from the grandmom to the mom to her. It all goes down through the female side of the family.
Yep.
Okay, very good. And what would you give her for she's got ADHD, okay, and she got a heart murmur?
I gave her the same thing, but a healthy brain and heart pack.
Okay. Yeah, 60 pounds. I'd go ahead. She's 8 years old. I'd go ahead and give her 1 full healthy brain and heart pack, okay, and give her a half a dose of breakfast, half a dose at dinner time, okay. And also, because she, let's see here, what was the other thing she had? Oh, the heart murmur. Is she on any medication for the heart murmur?
No, she don't, but she does have medication for the ADHD.
Okay. Now, that won't bother. Okay. So, as Shar said, and so she got to get off all the bad stuff. All right? I'd get her off the bad stuff, which would be sugar, of course, fried foods, processed meats, and oils. But as Shar said, 1 healthy brain and heart pack, a half a dose of everything at breakfast and dinner. Okay, we'll treat her like 100 pounds. I'd also give her the de-stress capsules. I'd give her 2 of those at breakfast, 2 at dinner time, and go there. It'd be imperative to get rid of all the sugar. I mean, everybody in the family is going to have to give up fruit juices and fruit, dried fruit, fresh fruit. They're going to have to give up syrups and agave syrup and honey and molasses and all that kind of stuff. Certainly no cereals for breakfast. She can have eggs. She can have poached eggs. And I'd get her some of these our shakes, our protein shakes. okay, either vanilla or chocolate, and make them with throw in some more eggs, and the chocolate. I give her some of the chocolate, the liquid chocolate, cocogevity, or even pieces of chocolate. Give her a little treat there. But it's glycemic friendly, so very, very useful here. And I think we're going to do fine. But everybody in the family, including boys, has a gluten problem. Okay, so you need to let your brothers and sisters know. You need to let your mom's siblings know, which means your aunts and uncles, they all have it. Your grandmother, she's still alive. She's got it. Everybody's got to get rid of the gluten out of their life. Shar hit the nail on the head. When you have irritable bowel syndrome, you pass it on to the kids and grandkids, and they have asthma. It's all been passed down through, and they'll have bowel problems as they get older. So exactly right. Give us a call every couple of weeks, and we'll make sure that this goes right. Okay, Doug, let's go to callers.
Let's head to Tennessee. And Liz, you're on with Dr. Wallach.
Hello, Liz, you're on the air.
God bless you, Dr. Wallach.
Well, you're a blessing. How can we help you today, ma'am?
Okay, I woke up the other night with a terrible cold from the weekend, and I called my doctor, and he prescribed levofloxacin 500 milligrams for 7 days, and he also gave me Robitussin DM. But through the night, my blood pressure just shot up.
Mm-hmm.
So I stopped taking the Robitussin, and I'm trying to see what do I need to do to get this blood pressure, because I have an ice pack on my head right now.
Okay, what do you weigh?
Around 195.
Okay, and how tall are you?
5'3".
Okay. Yeah, at 5'3", I'd like to see 110, 115 pounds, so you're 80 pounds overweight. Okay.
I'm working on that.
Okay, we're going to work on that, dear. Okay, do you have any other issues, any skin problems, eczema, dermatitis, psoriasis, any respiratory problems on a regular basis?
None.
Okay, good. All right. So, Shar, here's a gal with an upper respiratory problem. Doctor made a huge mistake by giving her antibiotics. How do you deal with a virus with antibiotics? And that doesn't compute. Mistake there. So what would you do for this lady? Needs to lose 80 pounds, and she has a cold right now, which is disrupting her life. What do you do for her?
Well, for the cold, I would give her the Killer Biotic and colloidal silver.
Okay.
And tea tree oil. Any one of those.
Okay. Well, all three.
All three, any one, actually. And then for the overweight, the ASAP. And then aside from that, I would give her, she doesn't have anything else wrong with her besides the cold and everything. Besides getting on a gluten-free diet, she needs to do that. I'd just give her 2 healthy start packs.
There you go. As Shar said, you want to get rid of all the bad stuff, no fried foods, no processed meats, no oils, no gluten. Get rid of all the inflammatory stuff out of your life. And I would take the Killer Biotic, take 3 of those 3 times a day. That'll be 3 bottles a month. That's to support your immune system. And 2 of those herbs in that blend actually have antimicrobial properties and can kill bugs, viruses, bacteria, fungus, and yeast. I would also gargle with the colloidal silver. As Shar said, go ahead and put a dropper full, not a drop, but a dropper full in a couple ounces of water. Gargle that 3 or 4 times a day. When you're done gargling, you swallow it. That won't hurt you. And then I would go ahead with 2 healthy start packs, as she said. That would allow you to have 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Ontane Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. And all that will support your immune system, which is very important here now. And you do that with 2 healthy start packs per month. And as Shar said, the ASAP, I would go ahead and take 1 dropper full under your tongue 30 minutes before each meal and leave it absorb through your oral tissues. Do not swallow it. It wouldn't hurt you. It's not going to be bad for you if you swallow it. You're just not going to get the full value if you swallow it, as opposed to leaving it absorb through your oral tissues. And then call us every couple of weeks. Let us know how you're doing. And if, what can I say? You want something. Do you ever get constipated or have diarrhea, anything like that?
Yes, but I work in the medical field, so I kind of have that under control. It's just the blood pressure. I'm really stressing with this blood pressure now. Okay,
well, what would you do for blood pressure, Shar?
Add the Ultimate Daily, too.
Add the Ultimate Daily, 195 pounds. I'd go ahead and take 9 of those a day. That would be 3 at breakfast, 3 at lunch, 3 at dinner. That's 2 bottles a month of the Ultimate Daily tablets. They're designed to support and promote healthy blood pressure. If you're on medication, you should be able to wean off of that. But the reason why, are you taking medication for blood pressure?
Off and on.
Yeah, and the reason why you're having a struggle with that, I believe, Liz, is you're not absorbing even the medication, and so it's imperative you stay away from that gluten, the wheat, barley, rye, and oats, and that way you'll be able to increase your absorptive efficiency. And you want to do that, and don't forget that ASAP, that dropper full under your tongue 3 minutes before each meal. You'll begin to lose a half a pound to 2 pounds a day, and we want to save as many in the medical field as we can. They tend to be a stubborn bunch, but we love you anyway, and so we'll take good care of you. Just follow the instructions and call us every 2 weeks. Give us a progress or lack of progress report. We'll walk you through this. Okay, Liz?
All right. Thank you very much.
You're very welcome, dear. Okay, well, hang on. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go to callers.
All right, let's head to South Dakota. And Diane, you are on with Dr. Wallach.
Well, Diane, you're on the air.
Hi, Dr. Wallach. I talked to you a while back about episcleritis, and the ophthalmologist wanted me to have a complete metabolic blood panel. It came back this morning. Everything was fine, except high cortisol was 27. Insulin level was 27.3, and I struggle with those off and on. I had it down to 17 for the cortisol about 6 months ago, but now it's going up there again. I take a lot of longevity. I've been on it for 6 years. I have celiac disease. I am gluten-free, no oils whatsoever. I try to eat good. I'm not on any prescription drugs. My blood runs between 70 and 85. My blood pressure is always really good. I feel good, but I can't sleep at night, wake up every hour and a half.
Okay, now, when you wake up, wait a minute. When you wake up every hour and a half, do you wake up to go to the bathroom, or you just wake up?
Oh, sometimes go to the bathroom. Depends on if I drink a lot of water, but just waking up.
Okay, do you ever have any creepy crawlies in your legs when you lay down, or feet, or leg cramps?
No, but I have pain in the lower back.
Okay.
That affects the left leg.
Okay. Do you ever have urgency on urination or failure to totally empty your bladder or anything like that?
Well, I used to, but I'm taking the stuff for the kidneys, and that really helps. That kind of solved all that for KB.
Okay. And let's see here. How much do you weigh?
Between 117 to 120.
Okay. And this episcleritis, is it manifesting itself in your eyes or your skin?
My eyes, and I'm realizing that what makes my eyes swell up is chocolate, peanuts, and cinnamon. I realize that.
Well, you have to stay away from them, don't you?
I know, but that's tough.
Okay.
Especially the chocolate.
Okay. And then the celiac disease, anybody else live in your house with you, or is it just you?
Well, I think my husband is too. He hates to admit it, but yeah.
Okay, so is he kind of fudging and having some grains?
Yes.
Okay. Yeah, you got to watch the cross-contamination in the laundry and the food preparation surfaces. So what I would do is encourage him to do his laundry in a public laundromat instead of at home where you're doing your same laundry. Okay? And do your sheets and all that kind of stuff at home, and let him wash his clothes at a laundromat if he's not going to give up gluten. Because where he sits, he's sleeping with you, food preparation surfaces, clothes in the laundry. And do you have a dog or a cat in the house?
No, but my daughter does, and my son does. And
can they visit you?
Oh, yeah.
Yeah. And so you're getting cross-contaminated, I believe. And let's see here. This episcleritis, is this a corneal thing? Are you getting cloudy corneas, or?
Real.
Yeah, tell me your eyes. I'm missing that. I didn't hear that.
Well, the white in my eyes gets real red, and it hurts.
Oh, I gotcha.
It's good today, though, because I haven't had any chocolate for a while.
Yeah. Okay. Well, just really watch that gluten. And so it sounds like you got everything pretty much under control. But the eye thing, I would go ahead and take an anti-inflammatory we have called CM Plus capsules. Okay, actually, are anti-inflammatory and analgesic, actually reverse pain and discomfort, itching, and they also get rid of inflammation, including in blood vessels as well as soft tissue, the brain, heart, every place else. I'd go ahead and take 3 of those twice a day, be 2 bottles a month. Make sure you're taking all 90 essential nutrients. Wouldn't hurt to take the Vision FX. I'd take 3 of those twice a day, 2 bottles a month. And also, I would go ahead and throw in one of our new products to help stem cells get going to manage and repair everything. Throw in the, Immortalium. I'd go ahead and take 2 of those twice a day, be 1 bottle a month of the Immortalium. And then give us a call, okay? Give us a call every couple of weeks and bring us up to date with what's going on with you after these little changes. Well, thank you so much, Shar. Really great job today. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.